Point Reyes Dialogues explores the great questions of life and our current condition. Within the context of the spiritual revolution of California, begun in the 1960s and continuing today, we inquire into their broad impact on culture, education, religious life, and moral values. Host Jacob Needleman, philosopher, author, and teacher, discusses these questions with guests who are recognized internationally for their philosophic, religious, and spiritual influence. Peter Newsom, M.D., was an emergency room doctor for 18 years, then trained in adult, child, and adolescent psychiatry. Dr. Newsom has spent over 40 years studying the brain and mind from neurophysiological, medical, and psychiatric perspectives. He has also studied meditation and mindfulness with some of the world's greatest teachers. Dr. Newsom's approach is mindfulness-centered healing. Holistic, based on trust, respect, and commitment to healing, mindfulness training integrates with psychotherapy and other modalities.
I've been looking forward to this a long time, Peter. You have been doing something of a kind of pioneering work, I would say, with young people as a psychiatrist. And could you just start our conversation, which can go in any number of ways after we get started, but you start just a few minutes about your work with, particularly with young people as a psychiatrist, and what you're trying for and where you think it's going, really.
When I came out of medical school, I had always wanted to be a psychiatrist, but when I graduated in '79, all the training programs that I applied at were run by Freudians, and you do 8 hours of interviews, and you'd walk across the parking lot like I didn't speak to a sane person today. So I felt so bad about doing training with that I went into the emergency room and did 20 years in the ER. And while I was in the ER, I started learning mindfulness. And the ER was where I really practiced it. It's sort of where I learned how to sort of swim that current. So
in the ER, if you don't mind if I interrupt you, but just a little. In the ER, you learned about mindfulness?
I did about 20 years as an emergency room doc. And during that time, I was being taught by some extraordinary teachers about this inner world called mindfulness. And so the ER was where I was somehow trying to swim that current, would be the best way to say it. So then finally I decided I wanted to do psychiatry because psychiatry had changed and there was a whole new school coming in called the biological psychiatry people. So I somehow assumed that they'd all done mindfulness like I had. So it was very interesting going through training because they really had not. But so what I do now is I think my own synthesis. I was trained as a neuropsychiatrist. I think the most frequent thing that I said in my training was, gee, mindfulness would do that just as good as that drug, and they would give me these strange looks. So now what I do, I call mindfulness-centered healing, because somehow what I saw going through training and what I've seen more and more for the last 8 years is that if I can get people to the center of their being, they'll really figure the rest out. And I keep on finding more and more ways to try to get them there.
Could you say, for the very, very, very few people out there who might not know what mindfulness means? It's an ordinary English word that means something not quite the same as what you mean by it. Could you say just briefly what you mean by mindfulness?
Mm-hmm. Mindfulness, briefly, is staying with what is really present. Of course, most of us come out of the thought-addicted culture, which is America.
Thought-addicted culture. Mm-hmm.
So in other words, in a thought-addicted culture, people have grown up surrounded by people who find it totally normal to think every minute of the day, which is not normal for our species, but it's normal for our culture. So we grow up bathed in that. So we become nice, normal Americans, which means we're thought addicted. Nothing terrible about it. And then all of a sudden I start to realize that gee, this thinking that's going on, I've come to assume that that's who I am. So mindfulness is when I start to kind of realize, oh, at any moment in the day, I could be off thinking, or I could be right here, and I could have my mind quiet and focused on what's right here and right now, which comes in about 3 or 4 forms. What's here and what's now is stuff that I see or hear. That's what we call exteroception. It's information coming in from the outside world. Or it's the sensation of my body, which is interoception. So mindfulness is staying with what's coming in, hearing and seeing, and what I'm feeling from my body, and not innerly commenting about it. So I'm learning, in a way, to surf. It's like I'm surfing on this amazing information coming in all the time and trying to stay up with that wave of what I'm seeing, what I'm hearing, and the sensation of the body.
Instead of thoughts, instead of ideas, instead of thought associations and explanations, trying to analyze and think what caused it, and et cetera, but a kind of a pure occupying of the purely present moment. Is that what you're speaking of?
Yeah.
With the attention that is also part of the human mind.
Exactly, and I always try to teach all my patients from day one, whether I'm meeting them in the hospital or at my office. I'm teaching them mindfulness from day one, always. If I can, 99% of the time you can help in some way. Start teaching them. I'm very careful to sort of say one thing, which is, now I don't want you to try to stop your thoughts. That just doesn't work. The brain isn't good at saying, don't do that. You know, the old joke about stop thinking about pink elephants. And so immediately, that's all that I can see. So instead I tell people, don't try not to think. Instead, we're learning how to put my attention all the time on the sensation of my body.
Mm-hmm.
So in a way, I'm learning how to sort of weld my attention to the sensation of the body.
And that is what we could also call presence. You're in the present moment, isn't it? To occupy the present moment and to occupy the body go pretty much hand in hand, would you say?
Absolutely. I don't think there's any other possibility, because thinking, by its very design, is a machine for leaving. Thinking, I call a there-then machine. It's always going off there and going off then, future, past, wherever. Whereas the body is a here-now machine.
Mm-hmm.
So if you want to somehow have some relationship with this moment, the door, or the first door anyway, is the body.
So what was among the first things you do with a patient is to help them, guide them, or suggest to them that they try to put their attention, some of their attention, more on their body than on the thoughts that are taking place in the mind. Is that right?
Yeah, and I've learned that now some of them now, especially the last couple of years, have done some kind of, whether it's yoga or meditation, which is always a huge gift, but a lot of them haven't. So I've just learned to try to try to streamline it. And I give them a first exercise, which is, I just say, okay, right now, can you feel your entire body head to toe? And I sort of coach them so they can really feel that continuously for, a few seconds. And then we just take a nice slow inhale, nice slow exhale. And I say, okay, now do that 50 times today. And after today, just do it whenever you're kind of anxious. So then they come back the next week, or the next day if it's in the hospital, and I can tell if they did it or not, because if it worked for them, there's this beautiful smile, like this sparkle of, oh my God, and that's a wonderful thing, because and you can immediately, they've felt some relief. They so often they didn't know that the quiet of the mind existed.
They didn't know the mind could do that.
No.
They didn't know they had that capacity. That's extraordinary. To imagine a culture in which many, or most maybe, young people and even adults have been brought up not knowing that the mind has this capacity.
Absolutely.
That's a remarkable thing. And these are very often younger people, teenage adolescents who are at some kind of risk or troubled or coming for therapy, and which is very often just drug-based, yes?
Well, I tell my patients that I try to treat adolescents anywhere from 12 to 60. Because in a way, I don't really, that's a little bit of a joke, but in a way, I would imagine whenever cultures get complicated enough, they must develop some sort of mindfulness system. We're sort of a young culture, but I don't think cultures can get complicated beyond a certain point without needing some kind of mindfulness. And look at just America turning to yoga now everywhere, and maybe we're starting to turn that corner. But I say, very often I try to teach both the adolescents and their parents. Because the parents, it's just as new for them. And what we're really getting more and more excited about now is trying to really do a form of mindfulness teaching to try to change the parenting, which I think is really exciting. And the reason being that, okay, if I've gone through grammar school and I've learned how to do my arithmetic and geometry or whatever the heck it is, so I've become a nice thought-addicted 13 or 14-year-old. So if my parents are nice thought-addicted 30-year-olds, in a certain way, the adolescent kind of knows, Mom doesn't really have it any more together than I do. They don't know why they know that. They just kind of sense it. And then if Mom starts getting quiet, well, it's as if there starts to be kind of two levels in the house. Mom is more quiet, so more able to listen. So maybe real adulthood is this direction of being more present.
That would be a new definition of adulthood for the culture, wouldn't it?
I'm afraid it would.
Well, so you found that drugs are not necessary. In fact, probably counterproductive in the long run.
Sometimes yes, sometimes no. If I get kids that are really in danger, whether they're bipolar or psychotic or seriously depressed, suicidal, I might use medications.
Uh-huh.
But I'm very kind of strict about, I always try to tell the patient, okay, we can try medication. I think it might be worth it in this instance, but if you take this medication, the first rule is don't believe in the medication. Believe in yourself. I always tell the patients, I think I told you about this a few weeks ago, I think about the medication as water wings. Just like when you're a little kid and they help you stay up at the surface so you don't drown. So I tell my patients, these medications are going to buy us a little time. They're going to sort of get you up to the surface, emotionally speaking, but they don't teach you how to swim. Mindfulness is how to swim. Once you really start to have mindfulness happening, right, then little by little, we take away the water wings because you're moving. You're moving on with your path.